So I just want to go from the high level impacts that we've been talking about. One of the big challenges, of course, is what do ordinary policymakers and people working on the sort of normal levels of local government do about this? So I wanted to just share some results from HyCRISTAL, which is a very large project. I think we've interacted with many of you in the past, and I just want to give credit here to a huge number of people who've contributed to this work that I'm going to present here. Oh, sorry, my slide is not progressing. Let me just sort that out. So in the HyCRISTAL project, we had a large piece of work that was looking at generating new understanding of the East African climate, and many of you have touched on these findings in the past. But the key point I want to make here is overall in East Africa, as we all know, the exact change in the rainfall pattern is uncertain. But one thing we're very sure about is that the incidence of intense rainfall will increase, and the peak intensity of rainfall will also increase. So as Andrew said, we can already see the effects of that in terms of these increasing incidents of fairly catastrophic flooding. So one of the things we know, even though there's still uncertainty in the models, is that we really have to think about improving resilience to extremes. And in infrastructure, there's quite a challenge because the planning horizons are quite long and quite out of step, really. They're too short for planning to the climate horizon, and they're too long for sort of immediate responsiveness. So one of the things we've been talking about in one part of the HyCRISTAL project is working with local government in Kampala and Kisumu to think about how we can reimagine and re-understand urban sanitation in the context of climate change. So the link here is, as I say, we know that climate is going to change, and therefore we know that rainfall intensity will increase. We know that that will result in increased incidence of serious flooding in urban areas, and that flooding results in specific damage to public health infrastructure. So on this slide here, these are all very familiar things that you will have seen. So, you know, when we get these intense rainfall, we see damage to sanitation structures. We see people investing huge amounts of their own money to try and protect their toilets and their houses from flooding. We see people emptying fecal waste directly into the flood waters, either formally or informally, well, either in a planned way or an unplanned way. We can see in the aftermath that we get this serious kind of contamination of the environment, and that links very much to the data that we saw in the first presentation about upticks in cholera epidemics. And we know that it becomes very difficult to manage the sanitation system, particularly where, as we often have in East Africa, we're dependent on trucking and sort of road or physical access to sanitation systems. And all of that obviously has high levels of potential negative health impact. Now, in this project, we tried to estimate the scale of that impact, because we're trying to create a link between making investments in improving sanitation infrastructure and climate resilience, partly as a way to help local governments to access climate funding. So in the two cities where we worked, we did a range of activities. We worked with communities to understand how flooding actually happens on the ground, how people respond and behave in flood events, and what the experience of health impacts is. So what do people understand happens when, you know, how frequent are increasing incidents of acute watery diarrhea, possibly cholera, enteric infections generally. Also, as part of HyCRISTAL, we did a lot of work trying to simplify some of the climate science so that we could use it to talk to local government and communities. So some of you will have seen our climate narratives that really try and articulate quite clearly how confident we are in this likely increase in intensity of rainfall events. And then we took these future rainfall patterns and we used those to generate downscaled future rainfall events, which we could then use to drive hydraulic flood mapping. So we could really start to look at what flooding is going to look like in the future under future climate conditions. This is a relief map of Kampala. Also, we hunted and found some of the really amazing data that already exists in both Kampala and Kisumu. So I'm just going to talk about Kampala as the example here. This is some fantastic data that KCCA have. They've been mapping their sanitation systems for a long time. So these are maps which tell us really where all of the latrines and toilets are in Kampala. And obviously what we're then able to do is overlay data that we have on sanitation systems with the flood data that we have. So here are some new maps that we've produced that really kind of show us where are the concentrations of poor quality latrines or high quality latrines or badly managed latrines or well managed latrines and intense flooding. Over here we've pulled out under a typical future rainfall event all of the latrines that might be flooded. And then what we're able to do, in this case, we've just taken McKinley, which is just one of the subcatchments, just to present the data, make it more simple to understand. We looked at what is the likely health impact of this overlay of increased flooding and the existing types of sanitation that we have. So we asked the question, how do these floods impact on the amount of fecal matter which is in the environment? And these are some results. Each one of these lines on this curve, this is a storm event, a typical future storm event over the first 6 hours. And in each of these lines, we're looking at one subcatchment of McKinley, and we're looking at the total amount of fecal waste that we estimate is going to be washed out into the environment. And what you can see is that this first spike here is actually not fecal waste that's in the toilets. This is all the fecal waste which is already in the drainage networks, because many toilets are either directly connected to the drains or the contents are regularly dumped into the drains. And then we can say, well, what happens if we could organize ourselves so that all the latrines were emptied before the major flood event? So, I mean, this is a notional idea of what would happen if all the latrines were emptied the day before the flood was coming. And ironically, what happens is we see a big increase in the amount of fecal waste in the environment. And that's because we know that a lot of people are still emptying their latrines into open drainage nearby to their houses or just beside their houses. So a more interesting question is, what if we could formalize and regulate latrine emptying and manage to make sure the latrines are emptied well before the floods arrive? And here at last we can see a fairly significant reduction in the total amount of fecal waste that enters the environment. Now this matters because it allows us to also understand what would be the probable risk that people experience. In a flood, we now know how people respond, where they go, whether they stay in their homes, whether they leave, and we can start to estimate their levels of exposure to fecally contaminated water. So this is taking all of that fecal waste data over the same 6-hour period and looking at concentrations of fecal bacteria and viruses and protozoa in floodwaters. And then we know quite a lot about how people can be exposed to those floodwaters. Some of you will have heard of the Sanipath project, for example, that helps us to estimate that. So taking all of that data, we're able to make a mapping essentially of what we think is the scale of the health risk to communities in each part of the basin. So that in this map here, this is the whole of McKinley, this is the lake down here. We can see, strangely actually, that the darkest colours, so the highest incidence of health risk, is actually at the upstream end of the basin, which is very counterintuitive. We were expecting to see the big impacts down here, but actually at the lower end you get quite a lot of dilution. So down here we're seeing much more sort of damage and psychosocial kind of stresses. Up at the top we're seeing these concentrations of infectious enteric disease and particularly fecal-oral diseases. And over here we can use QMRA modeling to turn those into probable levels of disease. Now, all of these numbers are quite, they're based on models, and we do ground truth them by working with communities. But what it enables us to do is to get a feel for the potential impact of investing in improving the resilience of these systems. Overall, this is really important because people themselves have very little agency in managing flood risk. So we're very used to saying, well, people should do something. They should make themselves more resilient. But these type of interventions to manage fecal waste in the city are very much something that local government has to play a role. And we're really hoping that we can use this data to enable local government to make the case that improving the resilience and the active management of the sanitation system and the drainage system has such strong positive health benefits that you can fold it into any climate resilient planning that you might make at the city level. And crucially, a lot of what's needed is this active management. So we're really trying to make the case that really good, well-funded operational budgets for local government are a key part of making critical public health infrastructure resilient. So I'm going to stop sharing. I hope that was just a quick rocket rocket fast tour through our work, and I'm very happy to take some questions at the end of the session. Thanks, Linda, back to you.